Limkin is the founding CEO of the Banyans Healthcare Group, a private health and wellness retreat located in southeast Queensland. Well-credentialed, Ruth's interest in health and holistic wellbeing springs from many years of working with those experiencing a need for support. Having researched and written extensively about community and social health, personal well-being, nutrition, and food security, Ruth has also worked with those experiencing stress, substance misuse, as well as those searching for a greater sense of meaning and purpose. Now, that's not as woo as it sounds. Welcome to Pure Health Hub, Ruth.
Thank you. It's really great to be with you today. I'm looking forward to the conversation.
Yeah, me too. So thank you. Now, in 2019, the World Health Organization classified burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. This is what I want to chat to you about today, because I know that the Banyans Healthcare Group has a particular interest and specialization in this area.
That's right, yes.
So tell me, might be an obvious question, but what happens when a mental health condition develops and it's not addressed or not addressed early? What's the ultimate outcome?
Yeah, so there can be a range of ultimate outcomes, and often, we've gotten a lot better in Australia at talking about mental health in the last 5 to 10 years, which I think is good. But one of the things we're still not great at talking about in Australia is substance misuse or addiction. And that actually can often go hand in hand with an untreated or undiagnosed mental health condition. Often it's basically people are self-medicating with whether it's alcohol or prescription medication or something else, sometimes compulsive behaviour, online behaviour. And they're self-medicating an undiagnosed or unmanaged mental health condition. And so, the cost of addiction to individuals and their families and their organisations can be significant financially, physically, emotionally, sort of interpersonal relationships. There's the most significant tragedy is our suicide rates in Australia, sort of 8 every day. Men's Health Month that I was looking at some information last week, 7 Australian men die from suicide every day. And so, it's staggering. And in one sense, I hope we never get used to that terrible statistic. And that is that can be the ultimate tragedy of an outcome.
Yeah, it is the ultimate tragedy. It is for an outcome such as that. What about women? We're not at, what are our numbers? Do we know?
So women are a lot lower. So if you're looking at about 8 people dying by suicide each day, and men are about 7, that's about 1 woman. There's a lot more, obviously, suicide attempts and self-harm that takes place. So, really significant. 1 in 4 Australian women will experience anxiety during their lifetime. Yeah,
exactly. It's and is a lot of this about workplace stress, or really, then the financial stress and all the other stresses that come along with that. And I'm not I think workplace burnout is a massive issue, but it's not 100% that, is it?
No, absolutely. And sometimes it's this false idea of there's all these segments of my life, and we forget that they all bleed into each other. We're integrated people. So, whatever's happening in our work life can affect our home life. What's happening in our home life can affect our work life, our physical health. We're an integrated being. Yeah. And so, but what I think is important is that we recognize that stress can come from our work, but it can also be outside of our work that affects our work. So it is a workplace conversation, regardless of where the stress originates. Gotcha. Whether we can divide it up, it's actually really important for people in the workplace to be alive to this issue and working out how to help people self-optimize.
Yeah, brilliant. Yeah, exactly. You're right. We are completely integrated. We talk about this, lifestyle balance, and I'm like, all of it, right? If we just, we can't just compartmentalize them because it doesn't work that way.
Exactly.
All right. Well, I was going to talk about substance misuse actually, because I think it really is now at epidemic proportions, is it not?
Oh, absolutely. Yes, absolutely.
And in your opinion, then, how can a workplace best address this problem?
So it's a really good question, because until we start having conversations about it, people suffer in silence. And so I think even just normalizing the conversation about it and just providing some education, I think demoralizing it. So often people think addiction is a moral failing or a choice. It's just a health issue. So, starting to give people some of the understanding and language that this is a health issue. It's often in response to mental health or trauma. A lot of people can end up addicted to prescription painkillers after surgery or a car accident or something like that. So the more we give people information, I think the more we start to make conversations able to happen. Yeah. One of the really practical things our workplaces can do is actually, whenever there's networking events, make sure there's really good alcohol-free options. Because people who are in recovery often talk about it's really difficult for them in the workplace because it's often an alcohol-soaked environment. So we can help people who are in recovery, but we can also provide really healthy options for people.
Well, that's interesting, because isn't the take-up of non-alcohol beverages really, spiking significantly? So why are we not,
exactly,
those in workplace environments, right? I mean, gee.
Exactly.
All right. Well, that's a really good way of addressing that. Then, okay, what are, I think the thing with substances, drugs, whatever, is you're right. Nobody wants to talk about it. And I think it's almost ignored and denied in the corporate world or businesses and things because it's too big a topic and, that sort of thing. But what is the risk to corporations and businesses if they don't address these things?
Well, I was talking to a group of leaders yesterday, actually, and one of the reasons I'm so passionate about leadership wellbeing is because of the positive ripple effect. When you can help leaders and individuals in workplaces get healthier, you actually help the organization get healthier. So, when we reduce the negative health impacts of substances and other behaviors, we're actually helping someone become more productive. It's as simple as if you're slightly dehydrated, so if you're not drinking enough water, 1 to 3% dehydration can mean your cognitive processes are less healthy. If you're not sleeping properly at night, and that can be impacted by alcohol use before bed, it really disrupts your sleep. So then you become more depressed, you become more sleep deprived, which reduces your productivity in the workplace. And, the healthier we get, the more productive we're going to be in the workplace. And we're going to reduce that burden of disease on the wider social economy as well.
And I guess there's also the accident, workplace health and safety in terms of, if people are coming in hung or whatever.
Absolutely. Absolutely.
I was never an angel, but I'm just saying that this is prolific, it really is proportions. So I guess that's the other issue too, right? It's just that the risk of accidents. All right, then paint us a picture. What does a mature workplace when it comes to well-being look like?
So I think the answer to that is recognizing that the answer is different for each worker. Right. So we surveyed our staff at the Banyans a while ago because we were trying to work out, we have a range of wellbeing initiatives, but we were trying to introduce something new, and we were trying to work out, how is people's personal well-being? What do they do to nurture that? How can we support that? And one of the key takeaway for me from the survey result, apart from the fact that everyone engaged with the survey really well, which doesn't always happen, is that everyone had a different way of nurturing their well-being. And so we introduced a well-being allowance for staff once a quarter, and essentially they can use it for whatever helps nurture their well-being, because we wanted to put the control back into the hands of the individual. And I think that issue of control and empowering the individual to have agency in the decisions they make is actually really important. there's not a cookie cutter approach because every person is different. Every person's lifestyle is different. And so, you know, the memes that go around of, oh, we're just going to put on yoga once a week and all our staff will be happy. Look, I love yoga, but people's schedules, you know, it's different for every person. So I think having the conversations, giving people education and empowerment, and putting the choice in their hands in a way that we can support as workplaces is actually a really positive, proactive way to improve that.
Yeah, absolutely. That is actually a wonderful way to do it because, yeah, exactly. Not everybody's going to go to the gym.
Exactly.
Yeah, it's going to be a million different ways. Absolutely. So that, well, that answers the next question about integrating and introducing. And I think that's a really great initiative. All right, then just something that I wanted to sort of finish on, but just talk about a little bit about is, and as I sort of told you before, you know, I spent a little bit of time, a few weeks in a day patient program in Sydney when I lived in Sydney about 10 years ago. And, you know, I think what a lot of this comes down to when we're overburdened and we're stressed and we're not sort of processing things. And you know, because we're not really thinking about what it is about us and what we want, I think. So, you know, your model addresses, you know, all the facets of one's life. So the emotional, social, occupational, physical, all of that. But of course, the spiritual needs to come into that. And often that is kind of, what is the meaning of life? What are we doing here? So without woo, it's, you know, so how is that, how important is that to our holistic health?
I think it's incredibly important. It's why it's one of the 6 facets of well-being. You know, a lot of the research shows that healthcare that recognizes spirituality gets better outcomes for people because we are spiritual beings. There's a spirituality and a sense of meaning that we all need. And when we don't have that, we feel a bit kind of lost in the wind because there's nothing to really center us and nothing to really provide that foundation of meaning, purpose, and hope. So, you know, that looks like lots of different things for different people. So there are people who really engage in faith communities, and that's a really important part of their spirituality. For some people, they feel connected to a sense of meaning and purpose by being out in nature, by engaging with friends, with family, you know, that sense of something outside of myself. One of the things we often say at the Banyans when we're helping people think through this idea of spirituality, it's where do you go for safety, meaning, and purpose? And that the answer to that question tells you a lot about your spirituality and whether you've really been able to find an answer to that. And I'm not being trite when I say that for some people, their sense of safety and comfort that they're finding in a bottle of wine. And so if we can help people find that in another way, then they're not relying on that alcohol or something to help them find that sense of safety and comfort and peace.
Yeah, absolutely. Goodness me, it was a big part of my life for a long time. But and that's just, I think it comes from, I guess, a little bit of an immature approach, right? Because we haven't spent enough time understanding who we are. And so, you know, it's like getting home from the office, you got the kids, you got, you know, everything's going on. Oh, let's calm down.
So it's so normalized. Normalized. All the memes are there, you know.
Oh, absolutely. So, oh, wow. And I think, you know, you absolutely just hit the nail on the head with that. Was beautiful. And I think that you're right. That's a huge part of that, all facets that you talk about at the Banyans Healthcare. And it's a perfect way to finish our chat today. Thank you so much, Ruth.
Thank you. It was a great pleasure.